Good afternoon, everyone.
Good afternoon, sir.
Good afternoon, sir.
Am I audible?
Yes, sir.
Can you see the screen?
Yes, sir.
Okay. So I came to know Mathur sir had started mechanics of spine. So, but I'm not going to teach the mechanics. I will discuss about the ligaments, various ligaments of vertebral column and its function. So, what is the main purpose of the ligaments of the spine? The main purpose is there are two main functions are there. One is it maintains the natural curvature of the spine and it protects the spinal cord. There are some more functions are there, but the major function is it maintains the natural curvature of the spinal cord. So you know what is natural curvature? That is the curvature which exists in the sagittal plane or frontal plane. What is the normal curvature? Normal curvature exists in sagittal plane or frontal plane. I am asking question. Yes. Normal
Sagittal plane.
normal curvature exists in sagittal plane. That is the lordosis and kyphosis, thoracic and sacral kyphosis, cervical and lumbar lordosis. They are the normal curvature of the spine which exist in sagittal plane. So this curvature is maintained by the normal tension in the ligaments, which we are going to study now. So what are the normal? If this is anterior, then this is cervical lordosis, thoracic kyphosis, lumbar lordosis, again sacral kyphosis. Clear? Thoracic and sacrum concavity, sorry, concavity is forwards or it is otherwise called as a kyphosis. And this one is lordosis. So you already know cervical and lumbar. So if yes, the muscle is also responsible to maintain this curvature, but ligament plays a major role in maintaining this curvature. Suppose if the ligaments are weak or if the ligaments are suppose if they cannot do its function properly, then what will happen? Either the ligament will be what the curvature will be exaggerated or it may be obliterated. So the main function of the ligament is it's limit the motion, it limits the spinal motion. Different ligament restrains different range of motion. We will discuss now. And it maintains the natural spinal curvature. And third is it protects the spinal cord. So this is the major function of the ligament. So what are the major ligaments of the spinal cord? Sorry, vertebral column. One is first is ligamentum flavum, supraspinous and interspinous, anterior and posterior longitudinal ligament, intertransverse ligament, and joint capsule. So these are the things we are going to discuss. We are not going to discuss in detail. I will just say the attachment and its normal function. So this is an image of the ligaments, various ligaments. First is ligamentum flavum. Clear? So we are going to discuss the ligamentum flavum, first ligament. So where is the ligament? This is the ligament. You can see the image. This is ligamentum flavum. This is the spinous process, posterior view of the vertebral column. This is posterior view. Clear? You know the lamina and pedicel of the vertebra. This is vertebra and this is vertebral canal. This is transverse process and this is a rough diagram. Clear? So this is vertebral body and this is transverse process and this is spinous process and this is vertebral canal where you can see the spinal cord here. Clear? And the spinal nerve root. So what is lamina and pedicel here in this diagram? Lamina and pedicel, this portion. This portion is called as a lamina and pedicel, shaded portion. Clear? So this is the place of attachment of ligamentum flavum. Attachment is between anterior surface of lamina above and posterior surface of the lamina below. So it is attached between two vertebrae above and below. Clear? Superior attachment is anterior surface of the lamina. Clear? And inferior attachment is posterior surface of the lamina. So what is anterior surface and posterior surface of lamina? So in this diagram, I'll I'll show what is anterior and posterior surface of lamina here. Clear? This is posterior surface. Clear? Body. Sorry. This is anterior. Once again. If you take the vertebra, if you take the vertebral body, this is anterior and this is posterior. Clear? Because spinous processes, it lies posterior. Body is anterior. So if this is the lamina, if this is lamina, then what is anterior surface? Anterior surface is, this one is anterior surface of lamina. Okay, lamina and pedicel. Clear? And this one is posterior surface of lamina. I think I am clear. So anterior surface of lamina is red color and posterior is green color. So now what is the attachment? Attachment, if you are taking the one more vertebra below, if I am taking one more vertebra below, I am just showing little larger. So anterior surface, if you see the attachment is between anterior surface of the lamina above. So what is anterior surface? Red color. Clear? And insertion is posterior surface like this. This is attachment. Anterior surface of the lamina above and posterior surface of the lamina below. When you take another vertebra below, which one is lying below? Clear? So here what will be attachment? I'll show in another color. Anterior surface of the lamina above, that is this one, from here to the posterior surface of the lamina below. That is this one, this border. Clear? Likewise, the ligamentum flavum is arranged you can see this is posterior surface of the lamina. Clear? And it is coming from anterior surface of the lamina above. Okay. The ligaments are thickest in the lumbar region. Ligaments are thickest in the lumbar region. Passive tension in a series of stretched ligament flavum limits the flexion throughout the vertebral column. So, what is the main restraining function of the ligament? It limits the flexion. Here, suppose if you take this as a if this is the anterior and posterior, clear, sagittal view of vertebral column, clear. So ligament is attached somewhere here, clear, between the laminas of above and below vertebra, clear. So if this is flexion movement, during flexion movement, these ligaments, it, it becomes taut and it restrains or it prevents the spinal flexion movement, limits the flexion throughout the vertebral column. So what we discussed? We discussed attachment, and we discussed in the lumbar region it is thick and it limits the flexion of the vertebral column. Next is it protects the intervertebral disc from excessive compression. Clear? Because the intervertebral disc is present between the vertebrae, intervertebral disc is present between the vertebrae. Clear? The tension in these ligaments, it prevents the excessive compression of the disc, intervertebral disc, and it contains high percentage of elastin. Clear? And it is thickest in the lumbar region, already we discussed. So ligamentum flavum, it lies just posterior to the spinal cord. You should know exactly what is the location just posterior to the spinal cord. So now I'm removing all these structures. Ligamentum flavum is lying just posterior to the spinal cord. I've told this is the spinal cord. Clear? And you can see the ligamentum flavum is lying just posterior to the spinal cord. Clear? If you see lateral view, you can see in this diagram here. Clear? So just behind this ligamentum flavum is the spinal cord. Spinal cord is running just in front of the ligamentum flavum. Clear? When you remove the ligamentum flavum, you can see the spinal cord. Clear? From posterior. That is, it is just lying posterior to the spinal cord. Severe hyperextension of the spine. So what will happen if this is the vertebral column, clear, or okay, this is the ligamentum flavum. Suppose if you take this as a ligamentum flavum, I make give another color. This is vertebral body and this is spinal cord. And this is lamina, pedicel, This is, you try to understand the image. This is spinous process. So what we discuss here is the attachment of the, here is the attachment of the ligamentum flavum. Clear? From superior, from anterior surface to anterior border to posterior border. Clear? So what will happen when you are doing hyperextension? This is flexion and this is extension. When you do hyperextension, what happens? There is this ligament, ligamentum flavum, it slacks or it becomes lax. Clear? So imagine this is one lamina and this is other lamina. If this lamina is approaching towards the superior lamina is approaching towards the inferior lamina, what will happen? The ligament which is present in between will try to move inward direction. The ligament, clear? Again I'll explain. This is the lamina above and this is the lamina below. You are seeing from posterior direction. Clear? So what will happen if this is the attachment of the ligamentum flavum, when the superior lamina is approaching the inferior lamina or both the lamina is coming together, what will happen? This ligamentum flavum will try to move inward. Clear? Severe hypertension of the spine can bulk the ligamentum flavum inward. And you know what is inward? Just behind the ligamentum flavum, what is present? Spinal cord is present. So what will happen when you are doing spinal extension movement or when you are doing hyperextension of the spine? Ligamentum flavum will lax and it will bulge inward. Ligamentum flavum will become lax and it will bulge inward and it will pinch the spinal cord, which is just lying posterior to the ligamentum flavum. Are you understanding what I am saying?
Yes, sir.
So this is about the ligamentum flavum. Again, I'll repeat fast. First we discuss attachment of the ligamentum flavum, anterior surface of lamina above. It is surface, not border. Try to understand. If you take the lamina, it is having two surface. Inner surface is the vertebral canal surface. Outer surface is, you understand, imagine what I am saying. Am I having any image? So this surface is called as a, so this surface, this is lamina. This surface is called as an anterior surface. Clear? So when you see from top or when you see from posterior direction, clear? This is anterior, body is present anterior and spinous process is present posterior. Clear? This is anterior surface or anterior surface of the lamina. Here it takes origin. And when you take two vertebrae, so when you take two vertebrae, so from anterior surface of above vertebra to the posterior surface of the below vertebra. What is posterior surface? This is posterior surface of the lamina. So what is lying inside? Spinal cord is lying inside. Clear? So just posterior to the spinal cord. So what will happen if the spine is hyper extending? Hyper extending, what happened? The ligament will during hyperextension, what will happen? The ligament will bend, bulge inward. Clear? The ligament will bulge inward, and it will pinch the spinal cord which is present inside. But this happens only in hyperextension, not in normal extension. Second ligament, supraspinous and interspinous ligament. It's not supraspinatus. Supraspinatus is the muscle. It's supraspinous and interspinous ligament. So where is this ligament? Attachment. Ligament extend adjacent spinous process. It extends adjacent spinous process. So where is the spinous process? So this is spinous process. This is spinous process. So it extends to the spinous process, that is from here to here. Only spinous process is attached. Clear? When you see from side view, this is the ligament. This is called spinous ligament. Clear? That is supraspinous, superior to the spine, and they will limit flexion. From the diagram, it is clear that when the spine is flexing, the ligament will become taut, and it will limit or it will restrain. Clear? Restrain the spinal flexion movement. And intertransverse ligament. Intertransverse. It extends between adjacent transverse process, becoming taut in contralateral flexion. So what is intertransverse? Intertransverse is when you see the from lateral view, clear. So this here is the attachment of the intertransverse. From the name itself, it is very clear. It lies between the transverse process. This is intertransverse ligament. So what will happen during contralateral flexion? If you do right flexion, this ligament will become taut. If you do left flexion, this ligament will become taut, or it restrain the lateral flexion of the vertebral column. In the cervical region, the supraspinous ligament is thick. In cervical region, supraspinous ligaments are thick, and it is otherwise called as ligamentum nuchae. You would have heard this ligamentum nuchae. What is the importance of ligamentum nuchae? Anyone can say? Can anyone say what is the importance of ligamentum nuchae? Am I audible? Am I audible?
Yes, sir.
What is the importance of ligamentum nuchae? What is ligamentum nuchae? Ligamentum nuchae is nothing but supraspinous ligament. What is supraspinous ligament? Okay. This is supraspinous ligament. Clear? It is attached between only to the spine. Clear? Tip of the spine. This is, it is thick in the what? Cervical region. When you see from the lateral view, it will be looking like this. Clear? In posterior view, this supraspinous ligament, it is thick. Clear? And this ligament, this thickened structure of supraspinous ligament is called as ligamentum nuchae. Now you tell, what is the importance of this? Not even single. And it starts from axis. Axis से चालू होता है, from axis. Not from. No idea?
Upper fibers of trapezius arise from ligamentum nuchae.
Who is that? Ashita? Ashish? कौन है?
Saleha.
Saleha. Yes, very good. So it helps in attachment of the trapezius muscle. Clear? And many more muscles, few muscles more are attached. Ligamentum nuchae also provides midline attachment for muscles such as trapezius, splenius capitis, cervicis. So these are the major muscle which is attached to ligament. It is ligamentum nuchae. So what is ligamentum nuchae? Ligamentum nuchae is the thickened structure of supraspinous ligament in cervical region. The ligamentum nuchae, so it prevents, or it is difficult to palpate the spinous process of the upper cervical vertebra. Clear? C7 transverse process you can palpate easily. Clear? When you do, after cervical flexion, it's a prominent vertebra, you know. It's easy to palpate the C7 spinous process. But when you go up superior, it's difficult for you to palpate the spinous process of other cervical vertebra because of this thickened ligamentum nuchae. It will not allow you to palpate the spinous process of the vertebra above C7. Next ligament, anterior longitudinal ligament. So we have discussed how many ligament? We have discussed ligamentum flavum, and we have discussed supraspinous. Clear? Interspinous. Interspinous we have not discussed. Interspinous, where it is present? Interspinous is present in between here. This is called interspinous. Interspinous is the this is interspinous ligament. What is supraspinous? This is interspinous. Okay. And what is this is supraspinous. Am I clear?
Yes, sir.
And intertransverse is between transverse process. And okay, all these things we discussed. So now the ligamentum nuchae, yes. Now anterior longitudinal ligament. Anterior longitudinal ligament, posterior longitudinal ligament is left now. So anterior longitudinal ligament, it is attached between the basilar part of the occipital bone. and the entire line of length of the anterior surface of the all vertebral bodies, including sacrum. That is, the occipital basilar part of the occipital bone and the entire length of the anterior surface of the vertebral body. So, what is the anterior surface? I'll show one vertebra and I'll explain. So, what is I cannot draw here. Anterior longitudinal ligament, it lies anterior here, and posterior longitudinal ligament is it lies somewhere here. One second. So anterior surface of vertebral bodies. So what is anterior surface of vertebral body? So if you take this, this is vertebra and this is transverse process, this is spinous process. Clear? So what is anterior surface here? This is anterior surface. This is anterior surface of vertebral body. And what is posterior surface? This is posterior surface of the vertebral body. If you, this is anterior and this is posterior. So for vertebral body, this is anterior and this is posterior. So this is the attachment of anterior longitudinal ligament and this one is attachment of posterior longitudinal ligament. This is you are seeing from top view, superior view. When you see the lateral view, this is spinous process and this is vertebral canal. So this is anterior longitudinal ligament and this is posterior longitudinal ligament. So anterior longitudinal ligament, it is attached between the basilar part of occipital and entire length of the anterior surface of the vertebral body, entire surface, including sacrum. And it is the strongest ligament. And there are two ends are there, cranial end and caudal end. Cranial end, it the anterior longitudinal ligament is narrow at its cranial end, wide in caudal end. You know what is the importance of this? Anyone? If you take this as the vertebra, I'll make a small. Any idea?
No, sir.
Yes. 1, 2, 3. I cannot draw complete vertebra, but I'll make. Imagine this is cranial end. Cranial end method is cervical region, and this is caudal end of the vertebral column. So when you take the anterior longitudinal ligament, it is narrow cranial and widen caudal. Narrow cranial means it is like this. As it goes down, it widens. The thickness, I am talking about thickness of the longitudinal ligament. When it goes superiorly, it is narrow. Can you see? Like this. It comes like this. Superiorly, it is narrow. Caudally, cranially, it is narrow, and caudally, it is wide. It covers entire gap between the vertebral body. Where is disc here? This is disc, intervertebral disc. So when you see inferior, that is caudally, the ligament, it completely covers the space. Completely covers the space. You cannot see you are seeing anterior view. This is anterior view of vertebral column. This is, you are seeing from front side, frontal side. Clear? Are you clear?
Yes, sir.
Huh. So in cervical region, it is it is not completely covered. You can see the disc here and here. Clear? But here it is covered. Clear? In anterior side. Now when you see posterior, or in this diagram I will show. चलो बीच में गिर गया. Okay. So when you see this is anterior side. Clear? This is anterior side. So when you see the attachment of anterior longitudinal ligament, it is narrow above, and when you come down, it covers the entire space like this. This is attachment of the ligament. Clear? So caudally, yes. This is cranial. Cranially, it is narrow, and caudally, it is wide. And this is anterior longitudinal ligament. It is opposite posteriorly. So posteriorly, what I have told, it will be, where is posterior for vertebral column? For vertebral column, this is posterior. Clear? This is posterior. You cannot see the ligament from outside, posterior longitudinal ligament. It is running inside the vertebral canal. This is anterior longitudinal ligament, and this is posterior longitudinal ligament. What is this ligament? It is supraspinous. Supraspinous is running outside the vertebral canal. What is posterior longitudinal ligament? It is running inside the vertebral canal. Clear? This is anterior longitudinal ligament, and this is posterior longitudinal ligament. Posterior, just posterior to the body. Are you clear what I am saying?
Yes, sir.
So now you see final drawing. This is vertebral body. This is anterior longitudinal ligament, This is posterior longitudinal ligament, and posterior to the posterior longitudinal ligament is the spinal cord. This is spinal cord, and posterior to spinal cord is ligamentum flavum. We already discussed. And what is this? This is spinous process. This is interspinous ligament, interspinous ligament, and this is supraspinous ligament. So the ligament from anterior to posterior is, first is anterior longitudinal ligament, then posterior longitudinal ligament, then in between the transverse process. What I have drawn is sagittal view. When you see the frontal view, when you see in this view, again you can see the intertransverse ligament, and then ligamentum flavum, and then supraspinous, interspinous, and supraspinous ligament. So these are the ligaments from anterior to posterior. Okay. Strongest ligament. Which is strongest ligament? Anterior longitudinal ligament is the strongest ligament of the all ligaments. Clear? And it is narrow in its cranial end and widens caudally. Posterior longitudinal ligament is opposite. Okay. Fibers of the anterior longitudinal ligament blend with the and reinforce the adjacent portion of the intervertebral disc. Clear? It blends. Anterior longitudinal ligament, it blends with the intervertebral disc. So if you take this is vertebral body and this is disc, intervertebral disc, and this is anterior longitudinal ligament. Clear? So what happened? This disc and anterior longitudinal ligament, it blends in the anterior portion. Throughout the vertebra, it blends. What is the meaning of blend? It is having close relationship. Anterior longitudinal ligament and the intervertebral disc is having close relationship, and it blends together. So what is the function of anterior longitudinal ligament? It's obvious. It limits the extension. It limits the extension of the, when you are doing spinal extension movement, anterior longitudinal ligament will become taut. And when you are doing spinal flexion, posterior longitudinal ligament will become taut. Or in other words, it limits the excessive flexion and extension of the vertebral column. Posterior longitudinal ligament, it lies between the C2. Here C1 is excluded. Posterior longitudinal ligament, C1 is excluded and is located within the vertebral canal anterior to the spinal cord. What does it mean? Within the vertebral canal. What is the vertebral canal? You already know. This is spinal cord, vertebral column, and this is vertebral canal. This is spinal cord. This is spinal cord. Within this is posterior longitudinal ligament. This is anterior longitudinal ligament. And where is disc? disc is here, intervertebral disc. Posterior longitudinal ligament is located within the vertebral canal. This is posterior longitudinal ligament. It is present within the vertebral canal and anterior to the spinal cord. This is spinal cord. It lies anterior to the spinal cord and within the vertebral canal. Posterior and anterior longitudinal ligaments are named according to the relationship of vertebral body, not spinal cord. Keep in mind this. Anterior and posterior longitudinal ligament is named according to the relationship of vertebral body, not spinal cord. वर्टिब्रल बॉडी का सामने एंटीरियर लॉन्जिट्यूडिनल लिगामेंट, वर्टिब्रल बॉडी का पीछे पोस्टीरियर longitudinal ligament. Don't confuse with spinal cord. It is not in relation with spinal cord. Spinal cord का anterior is posterior longitudinal ligament. Are you clear? And further anterior is anterior longitudinal ligament. This is vertebral body. And posterior longitudinal ligament blends again with the intervertebral disc. Clear? Like we have discussed already, anterior longitudinal ligament, it blends with the anterior portion of the intervertebral disc. And posterior longitudinal ligament, it blends with the again with the intervertebral disc. And last point, cranially, posterior longitudinal ligament is broad structure. Cranially, posterior longitudinal ligament is broad structure, and as it goes down, it narrows. Clear? As it goes down, it narrows. So what is the importance of this point? Who can tell now? This is what I was asking earlier. Still you have not got it? Anterior longitudinal ligament is narrow superior and wider inferior. This is anterior longitudinal ligament. And posterior longitudinal ligament is wider above and narrow below. This is posterior longitudinal ligament. Anyone? What is the clinical importance? In orthopedics, you would have studied. If you don't know, you tell me. I'll proceed. Hello?
No idea, sir.
Okay. So do you know what is PIVD? PIVD? What is PIVD?
Posterior intervertebral disc prolapse.
It is common in cervical region or lumbar region. Most common, where it is common, most common. Lumbar intervertebral disc prolapse is common, or cervical intervertebral disc prolapse is common. Which one is more common? बताओ. Yes, please. Don't know.
Lumbar region.
Lumbar is most common. Yes, you are right. So, what is the reason? Arrangement of posterior longitudinal ligament is the reason behind the lumbar disc prolapse. Why it is not most common in cervical? Why it is common in lumbar? Okay. Mm, okay, I will draw the vertebra. I will complete in 5 minutes. I am drawing the now posterior surface of the vertebral column. This is posterior surface. Clear? I had removed the, okay, and this is intervertebral disc. Intervertebral disc. Imagine this is C1, C2, C3, so and so. Now this is posterior surface of the vertebra. Imagine this is posterior surface. So posterior longitudinal ligament, it is broader in it is broad or narrow cervical region.
Sir, broad.
Broad.
Broad. Okay. So which is okay, if you take this as the cervical region, it is broad, that is it is covered, it goes okay. Imagine this is lumbar. There should be many more vertebrae in between. You just imagine this is lumbar and this is cervical. Clear? It is broader in cervical and narrow in lumbar vertebra. This is what ligament? Posterior longitudinal ligament. So now, if you take the intervertebral disc, see here, you see there is a gap on either side. That is, disc is not completely covered in the lumbar region. Clear? Disc is not completely protected in the lumbar region. But when you see here, the disc is protected completely. Or if you see, if you want me to draw other view, this is complete. This is posterior longitudinal ligament, and this is anterior longitudinal ligament. And where is spinal cord? Spinal cord is present here. This is spinal cord. And where is intervertebral disc? Here is the intervertebral disc. And this is anterior and this is posterior. Clear? So now this disc is completely covered in the posterior side. This is sagittal view, and this is frontal view. Sorry, posterior view. Are you clear with the diagram?
Yes, sir.
So this is posterior view and this is sagittal view. This is sagittal view. Clear? So what is PIVD? PIVD is posterior intervertebral disc prolapse. That is, if the disc is prolapsed in this direction, it is called PIVD. Clear? And in cervical region, this prolapse is possibility of prolapse is less. Why? Because the disc is protected. Because the disc is protected completely in the posterior direction in the cervical region. Clear? And where is spinal cord? Spinal cord is lying here, posterior to the ligament. So what will happen? The disc, if the disc is getting prolapsed, if even if the disc is moving, pushed out, the ligament is giving support. Posterior longitudinal ligament is giving support, and it will not impinge the spinal cord or spinal column. So that is why in cervical region, PIVD is less common. PIVD is less common. Are you clear what I am saying?
Yes, sir.
Okay. Now, opposite to that, here if you take the lumbar region, in lumbar region, the posterior longitudinal ligament is not supporting thoroughly or completely. This is what view? Posterior view. Clear? This is posterior view. When you see this view or the lateral view, imagine this is the lumbar vertebra. Clear? In the lateral view, yes, you can see you can see the ligament. But in this view, in the posterior view, it is not covering the complete entire disc. So what will happen during flexion injury? What will happen? The disc will prolapse posteriorly. Clear? This part of the disc will get prolapsed posteriorly because it is not covered on the either side. Only central part of the disc is covered. So what will happen? There is a possibility of intervertebral disc prolapse in the lumbar region because it is not. Why? Because the ligament is broader cervical region and it narrows in the lumbar region. So what will happen? The disc is exposed in the posterior side, and this part of the disc will get prolapsed posteriorly. So that is the importance of this orientation of the ligament. Any doubt?
No, sir.
So if someone asks you why the PIVD is common in lumbar region, there are 5 reasons are there. There are 5 reasons. One reason is the orientation of the posterior longitudinal ligament. The posterior longitudinal ligament is completely covering the posterior surface of the intervertebral disc in the cervical region, and it is not completely covering the posterior surface of the what? Posterior surface of the intervertebral disc. That is the main reason for this. Is one reason. Clear? So other reason you would have sometime we will discuss in PAVD. Clear? And last one is joint capsule. What is the time? Okay. You go through the what lectures you are having now?
सर राहुल सर का लेक्चर है.
अच्छा राहुल सर तो कंप्लीट राहुल सर लेफ्ट. Okay, last ligament I will complete. The last ligament is it's not ligament, it's a capsule, joint capsule. So joint capsule, it surrounds the apophyseal joints. You know what is apophyseal joint? Apophyseal joint is present on either side, right and left of the vertebral joint. It's otherwise called as a B joint. A joint is intervertebral joint, B joint is apophyseal joints. You know where is apophyseal joint? Yes? Do you know? Yes or no? Hello? Hello? Pur?
Yes, sir. Yes, sir.
What is apophyseal joint? Pur, what is apophyseal joint?
No idea, sir.
Oh, what is this? Anatomy hai. You know what is apophyseal joint? So there are two joints are there in vertebra. This joint is called as intervertebral joint. Clear? And this joint is called as an apophyseal joint. Here one apophyseal joint and here is another apophyseal joint. This joint is called as an apophyseal joint. Clear? And what is other joint? Other joint is intervertebral joint. Okay, I'll draw this one. This joint is called as an intervertebral joint. Clear? This is a joint. There are three joints are there between two vertebrae. Between two vertebrae, there are three joints are there. What are the three joints? One intervertebral joint and two apophyseal joints. So this is one. That is first joint is intervertebral joint. And second joint is when you see in the lateral view, when you see the lateral view, here is one joint. Clear? This is the vertebra below, and the vertebra above will also have the joint here inferiorly. So these two joint it makes apophyseal joint. Clear? And what is the intervertebral joint? Intervertebral joint is this joint between disc, and a disc is present between two vertebrae. So this is one joint and this is 2 and 3. So between two vertebrae there are three joints are there. two apophyseal joint and one intervertebral joint. So this apophyseal joint is having a joint capsule. Clear? Joint capsule surrounds and reinforces each apophyseal joint. And this capsule is loose, especially in cervical region where maximum range of motion is required. Clear? This joint capsule. Clear? So, you are doing cervical range of motion. Clear? So, range of motion in vertebra occurs in dash joint. One vertebral joint, two apophyseal joint. Which is right answer? Yes. Normally the range of motion, it occurs in which joint? Come on. Purv,
Yes, sir.
answer. Range of motion occurs in which joint? One or two. Give any one option. I am not giving four option. I am giving two option.
Sir, vertebral joint.
Range of motion occurs in apophyseal joints. Flexion, extension, rotation, side flexion, range of motion occurs in apophyseal joint, not in vertebral joint. Intervertebral joint does not. Yes, the joint play, the main joint play, it occurs in apophyseal joint. Okay. So this apophyseal joint is covered by the joint capsule. Clear, and it is loose. From this point itself, you should answer. You should have answered. It is loose in cervical region where ample range of motion is required. The capsule of the apophyseal joint is reinforced by adjacent muscles. And these are the functions of the ligament which I have explained you. Okay. You have to study anatomy. You know the anatomy, basic anatomy. Okay, you go through this tabulation. So I have explained the function of the ligaments in the tabular form. Kajal? Kajal? Kajal Yadav? Maithili?
Yes, sir.
Am I audible?
Yes, sir.
Name the ligaments of vertebral column. audible?
Anterior and posterior longitudinal ligament.
Or
Ligamentum